Mr. President, the Senate has spent a great deal of time over the last 6 or 7 months debating health care in America. For years after the passage of the Affordable Care Act, the Republican Party, House and Senate, has called for the repeal of the bill. And yet when the time came with a majority of Republicans in the House and the Senate, and of course a Republican president, and the task was immediately before them, they faltered because they didn't have a replacement. They didn't have something to propose that was better. And as a consequence, their effort stopped short, one vote short, on the floor of the Senate several weeks ago. Now, we still face some challenges, significant challenges. Some of those are very immediate. Before the end of September, we will face the prospect of needing to reauthorize the Children's Health Insurance Program, known as CHIP. This program provides health insurance coverage for more than 9 million children and pregnant women across the country, 350,000 in my state. This vital program, the CHIP program, has had 2 decades of broad bipartisan support, and it's going to expire in 12 days. The good news is the Finance Committee Chairman, Orrin Hatch of Utah, and his ranking member, Ron Wyden of Oregon, have reached bipartisan agreement on a 5-year reauthorization of the CHIP program. The bad news is instead of preserving health care for lower-income children and pregnant women, Senate Republican leadership seems more interested in the next 12 days of calling a different topic, a different issue, or bill altogether, the Graham-Cassidy bill relating to health insurance across America. That bill would take health insurance coverage away from millions of Americans, including 1 million in the state of Illinois. From where I'm sitting, reauthorizing the CHIP program is a priority to not only serve the 9 million children and pregnant women across our country, but 350,000 in my state. And there's another bill. We need to reauthorize before the end of September the funding of our nation's community health centers. Like CHIP, funding for community health centers expires at the end of this month, in just a few days. Also like CHIP, community health centers have enjoyed decades of broad bipartisan support. We have 10,000 community health centers across our country. They serve 26 million Americans. Community health centers serve 1 out of every 10 children, 1 in 6 Americans living in rural areas, and more than 330,000 of our nation's veterans. Illinois' 52 health center organizations receive $150 million in federal funding in order to provide care to the 1.3 million people at 360 locations in the state of Illinois. I've been to many of these locations, and I've said in real candor and honesty, if I had a medical issue or one in my family, I would enter the community health centers of my state with confidence that I would receive, my family would receive the very best of care. They are outstanding organizations. So if Congress doesn't act within 12 days, community health centers in my state and across the nation will see their funding cut by 70%. That dramatic funding cut would result in 2,800 community health centers closing across America, 50,000 jobs lost, and 9 million people losing access to health care. Well, there's good news here as well. Because of Senators Blunt and Stabenow taking the lead, they're pushing for swift reauthorization of community health center funding. But the problem is, there's another bill, the Graham-Cassidy bill, which has captured the attention and apparently the calendar time for the Senate. At least that's the possibility we hear. So why shouldn't Congress be spending the next 12 crucial days in reauthorizing the Children's Health Insurance Program across America and making certain that our community health centers don't lose the federal funding, critical funding they need to serve so many people? Right now, we know that we face some challenges when it comes to the health insurance market in America. Approximately 6% of Americans, 3% of people in my state, purchase their health insurance in the individual marketplace, with more than 50% of these people receiving some subsidies to help pay for cost. However, many of these people are seeing dramatic increases in premiums. We know that, and we know it's a challenge. and one that we need to address. Here's the good news, and it's time for some good news when it comes to health care. Almost from the minute that the critical vote was cast, ending the repeal of Obamacare, meetings started taking place. I can recall as the Senate was adjourning, I looked back by the cloakroom, there were Senator Lamar Alexander and Patty Murray talking in the middle of the night. It was about 3 a.m. I later learned that they had reached an agreement between them, a Republican, a Democrat, on the Health Committee, to start a series of hearings about what we could do as a Senate that would actually strengthen the healthcare system in America. That was before our August recess. When we got back from recess, they kept their word. And I attended 3 or 4 of the member hearings which they held before the official public hearings a little later in the morning. These were good meetings. In the first one, I recall Senator Alexander saying 53 senators, Democrats and Republicans, showed up for coffee and donuts to meet with insurance commissioners from 5 different states. Just a few days later, after that, another coffee and donut session, another good turnout, bipartisan turnout of senators, as we sat down with 5 governors, Democrats and Republicans, and talked about health insurance. Later on, a few days later, another meeting where experts came in and talked about the subject. I felt there was more accomplished in those 3 hours with those outstanding witnesses from across the country than all of the time we had spent giving speeches to one another on the floor of the Senate in the previous 7 months. And it was interesting. When you brought in these people from different states, different political parties, they virtually had the same thing to tell us. There were a handful of things which we could do that could make an immediate impact, a positive impact, to make the cost of health insurance a lot more predictable. Not to say we're going to bring it down. I don't want to be over-promising, but to slow the rate of growth in health insurance cost, as well as providing stability in the insurance market. Here are the things that came out loud and clear from these bipartisan Senate meetings. First, they told us stop playing games with cost-sharing reduction subsidies. These are subsidies to insurance companies that take on individuals with expensive health histories. These insurance companies are given support by subsidy so that they can keep the premium costs for these individuals under control. These cost-sharing reduction subsidies help 7 million Americans afford their co-payments and deductibles on their health insurance policies. The current Trump administration has repeatedly threatened to stop the payments. And as a result, individual market premiums keep going up because of the uncertainty of whether the government's going to keep its promise to make these cost reduction subsidies. I remember the commissioner from the state of South Carolina, and he told us, I say to the senator from Oregon, who's our ranking Democrat on the Finance Committee, he said, I am going to announce a 30% increase in health insurance premiums. If I knew that these cost-sharing reduction subsidies were coming, it would be 10%. I can eliminate 20% of the anticipated increase in premium costs if these subsidies came through. Well, it's pretty clear to me this is sound policy on a bipartisan basis that would have a dramatic impact in reducing the cost of the subsidy, the cost of premiums to many individuals. That came through loud and clear in every meeting we had with Senators Murray and Senator Alexander. The second thing they talked about was state reinsurance. And I don't understand that as well as some, but it has worked in states where the state picks up a share of the liability for health insurance between certain dollar amounts. And so the private insurance companies don't end up with that burden. Because of this reinsurance, they're able to keep premium costs down. The third thing is to provide states with more flexibility without undermining some really fundamental issues, without undermining, for example, the pre-existing condition protection, which we currently have. I left those meetings feeling encouraged. After 7 months of bitter political rhetoric, which led to nothing on the floor of the Senate, we were finally sitting down on a bipartisan basis with people, Democrats and Republicans from all across our country, with specific suggestions that could help our healthcare system. That, to me, is the way to move forward. That, to me, is the lesson learned from much wasted time so far this year. But unfortunately, that whole effort may be derailed. Senators Cassidy and Graham have come up with a legislative alternative that they want to move forward. Unfortunately, this measure that they have proposed has not been scored by the Congressional Budget Office, nor carefully measured to find out what impact it would have on the American healthcare system, which accounts for 1/6 of the American national economy. Here is what we know about the Cassidy and Graham proposal. What they are suggesting is basically eliminating the subsidies that help individuals pay for private health insurance and bringing to a halt the Medicaid expansion, which has covered millions of Americans and given them health insurance. What they say instead is something that's been said many times on the floor. Well, we'll just give all the money to the governors and they'll figure it out. They'll figure out how to save money in their states. It turns out that governors of both political parties warn us that if you're going to give us a set amount of money, as the cost of health care continues to go up, don't expect us to cover as many people or to provide as good a coverage if we do it on a state-by-state basis. So who supports this new Cassidy-Graham approach and who opposes it? Every single medical advocacy group, the hospitals, the doctors, the nurses, all across America oppose this Cassidy-Graham approach, as well as the medical advocacy groups, because they understand that their approach would allow discrimination against individuals insured based on a history of pre-existing conditions, going back to the bad old days before we passed the Affordable Care Act. The Cassidy-Graham approach, which they brought to us, doesn't add up. If you take $300 or $400 billion out of this healthcare system, dump it in the laps of governors around this country and say, good luck, do it on a local basis, I'm sure it'll all work out. They will quickly tell you, as they have in the meetings that we've had, the bipartisan meetings, it will not work. It does not compute. It may be able to check the box for some that they repealed the Affordable Care Act, but they certainly didn't replace it with anything of equal or better value. The opposite is true. And that's why I think we ought to think twice. There is a mad dash now in the last 12 days to do many things. From a political viewpoint, there's a limited opportunity for this repeal effort. That 12-day period is a limited window under the Senate Rules of Reconciliation. It's a mistake, as far as I'm concerned, for us to move toward Cassidy-Graham, concepts which have been roundly opposed in my state and across the nation, concepts that have failed on the floor of the Senate. Let us roll up our sleeves and do three things that do make sense. Let's reauthorize the Children's Health Insurance Program. Let's make sure those kids and their pregnant moms are going to have the basic coverage that they've enjoyed for almost 20 years. Let's also reauthorize the community health centers. We know they work. We know that when people have a medical home, they're less likely to let medical conditions get worse and more expensive. That, to me, is a good investment to make sure they continue. And finally, let's turn toward a real bipartisan effort, a measure that can emerge soon, I hope within days, from Senators Murray and Alexander on a bipartisan basis. Now, I know they're still working on it. They haven't reached a final agreement on what they're doing. But I hope all of us in both political parties will encourage them to do the right thing. Do you remember when John McCain came to the floor after he'd been diagnosed with the cancer that he's battling now? He came here and cast a crucial vote to proceed to debate this whole issue of health care. And then he asked to speak for 15 minutes, and I stayed in my chair. I wanted to hear it. And he reminded us of the importance of doing things on a bipartisan basis and doing them thoughtfully when it comes to something as important as health care. Let us keep that speech by John McCain and that lesson in mind. Let us resist this Cassidy-Graham approach, which has no support when it comes to the medical community, and instead work on the bipartisan approach from Alexander and Murray, together with the Finance Committee, which I know Senator Wyden is going to address next, so that we can have a bipartisan solution. The American people sent us here to solve problems, not to create them. Cassidy-Graham creates problems. Let's find solutions that solve problems.